Um, and we obviously care for the senior living community, but a lot of other people as well. But I invited Tyler Amundsen with Big Sky Senior Services, and he was unable to be here, but will present, and we work a lot together. Obviously, our focus is coordinating care and just caring for the senior living community any way that we can. So let's get started here.
Life is in constant motion, bubbling over with family and friends. Things to do, projects to focus on, passions that energize you. From the time you take your first step to the time you embrace your first grandchild, it just keeps moving. And a moving life is a full one. But sometimes things take a turn that slows us down or even stops us in our tracks. That's where Synergy Home Care comes in, to bring you life-energizing care on your own terms, in your own home. No matter what the situation is, we're there to care with whole hearts and open arms, creating new and innovative ways to serve you, to keep you moving forward. Because the purpose of care isn't just to keep life going. It's to keep you living fully. Synergy Home Care. Care that moves you.
So, oopsie, just skip that one, sorry. But today we're going to understand, what aging in place is, and aging in place means a little bit, it means about the same thing to everybody, but what's important about that is 9 out of 10 people want to age at home. So home can be anywhere that they call home. Could be their independent living facility, could be at their home that they lived in the last 30 or 40 years, or it could be living with their son or daughter or a loved one. But nearly 90% of adults over the age of 50, all races, income, everything, want to age in place. And that's where we feel home care can really help serve this need. So that's a huge percentage of people. Oh. Are you guys hearing that buzz?
No. Crystal?
All right, can you hear me better now? Did you guys hear a buzz there?
Yes.
Oh, we didn't hear anything, Crystal.
Okay, must have been my video. So we're going to talk about, obviously, the aging in place, but I'm going to share a lot of statistics just to help you guys understand how important home care can be and help an elderly thrive as best as possible. So, we say why not home care, because as you can see, 70% of adults will likely need some sort of long-term care in one form or another during their lives. And obviously that varies, sporadic, it varies a lot for a lot of people, but that's a huge percentage of our people that we care for, but each and every one of you have in your family, extended or immediate, to think about. So with home care, we can help your loved ones, our loved ones, thrive and maintain independence at home. And that's probably the biggest word that home care means to us, is independence. And it's something that's fairly easy to get started without a huge change in their lifestyle, a huge change in investment of money to do it. And it can be very flexible. We can work around the clock. And many times agencies like ourselves, we are 24/7. So for those people that need a whole lot more care, or if mom and dad just need more help on the weekends and you can't be there, then you can have respite, have people like ourselves come in and just secure their safety. And the biggest thing is just help them thrive and live the very best quality of life possible. And we will talk a little bit more about respite. We know that primary caregivers are exhausted because they think they can do it themselves. And with that exhaustion comes a whole slew of things and problems generally that start for the caregiver themselves. So again, home care for us means independence at home. And again, at home can be anywhere that they call home. So we do go into assisted living facilities, we go into independent facilities, and even memory care facilities. If people need more one-on-one care than can be provided, a caregiver can come in and provide that one-on-one care, sitting care, companionship. But for the most part, not home care is non-medical care, and it's provided by trained caregivers at Synergy. Obviously, I can only speak as to what we do, but we are licensed, insured, and bonded. We provide nationwide background checks. But the whole goal of home care and having a caregiver with them, in my eyes, is we would do everything that a family member would do for their loved one that can't be there. So assistance with all activities of daily living. So first and foremost, their safety, treating them with dignity, respect, compassion, and care. We have online portals available too to help keep family that isn't near or might live in different states or in another country. They can log in online and keep as informed as to how mom and dad's care is going, or whether it be grandpa and grandma or whatever. So our whole goal is not only to help the individual at the center, but also how can we help the household as a whole. And I'll go into that more details there. But with home care, this gives a good snapshot of everything that we can help with. And again, you know, it's basically if you think of if a son or daughter or whomever might be helping, if these are issues that or anything that they're helping with, we can come in and provide that. But companionship is huge. And I think a lot of times it's overlooked. But one thing the pandemic has showed us, elderly are afraid of maybe getting locked in again, not being able to socialize the way that they used to. Even in isolation, you can have a caregiver. That means you can play cards or play games or just visit, do the things that they like to do so they do not fall into potential depression or something like that. But so respite care, 24/7 care, personal care, you guys can see all those things there. But the biggest thing to us is we will help them with anything that they would like help with. That's the whole point of home care, is to make them comfortable in their home and thrive in their home as much as possible. Home care is for basically anybody that needs it. It's very simple. You do not need doctor's orders to get home care lined up. You know, we can work alongside someone that already has home health coming in, because they might be only coming in an hour every third day or a couple days a week. Or same with hospice. You may have hospice lined up, but end stage hospice is a lot for family to fill in. If it's 23 hours a day that maybe hospice isn't there, or even, you know, 20 hours a day is a lot if it's becoming a lot of work with the end stage or anything like that. So, but our whole goal is to help people that are transitioning back home from having to stay in the hospital. So whether it was just a sickness, illness, or a surgery, or a break or something like that, if they are a fall risk, having home care there to keep them safe, make sure that they're taking their meds, that they're getting nutritious meals, that they're bathing, getting dressed, all those things. And helping the primary caregiver perhaps get good sleep in the night. So we help patients of all kinds, and some things that you can watch for, whether you be a neighbor, a friend, you work in, in a hospital or in an assisted living, senior living home care setting. Look for weight loss, decline in hygiene. If you see that meds are still in a pill box from 2 days ago, if they're just eating candy or donuts, and you can just look around and see that their house is not up to par where it normally is, or depression. Like, these are all signs that each and every one of us can help and say, can I have somebody reach out to you? We can get you some help. We can get you assistance. And so, like I said, even with home health coming in, you're the eyes out in the field where you can see, in hospice, where you're in somebody's home, you can see if someone is struggling or just needs a little bit of help. And again, we don't need to rush them off to move somewhere else. Maybe we can just get somebody in there for a couple of hours a day to help support them and take care of these things that have become overwhelming or a burden, or they're just not interested in doing anymore. So I prepared a couple of snapshots of some pretty typical patients that we work with. So let's take, for example, Mr. Smith. 86-year-old male, lives with his wife, who is also his primary caregiver. He is on end-stage hospice. So this is end of life, so it's a lot of duties. The wife cannot really go anywhere anymore, because when hospice isn't there, she's the one that's providing everything. So making sure his oxygen's on, trying to keep him clean, rotating him from side to side. So we can come in and help this family so that the wife can still, whether it be going to a lunch at her church every now and again, or even going to church, or just meeting up with friends, can kind of keep that social interaction that she has always enjoyed. But mostly in this situation, we can come in and just take over his immediate needs, the repositioning every 2 hours, sponge bathing, making sure he's having his fluids, try and keep him as comfortable as possible, keeping him clean. And then once his immediate needs are all met, our caregiver can help Mrs. Smith with all the household chores. So anything that needs to be done around the home, whether it be laundry, bedding, making meals, but more so that she can get some much needed rest. She has been skipping her appointments because she's caring for her spouse, and next thing you know is her health will be the next to deteriorate. So this would be an example where we could have caregivers in there 24/7, 12-hour shifts around the clock, just to meet the patient and family's needs and help support them. Second example would be Miss Jones, 62-year-old. She lives alone. She has a full knee replacement. She's going home with PT through home health, but she doesn't have anybody near. She doesn't want to be a burden, have her daughter fly in and take care of her. She is a fall risk. Her house, unfortunately, has a lot of stairs. So we'll have a caregiver be with her, be standby assist at all times. So we just are going to be there, coming in, helping her get up and ready for the day. So that might be getting up, helping her take a shower, getting dressed, making breakfast, make sure any meds are taken, make lunch before we'd have to leave at noon, and then come back again in the evening and help her get ready for bed. So obviously she can make her own decisions, she can communicate her needs, but our whole goal too, again, is if you have a knee replacement, you're not supposed to be doing stairs, and we can do the laundry, do the vacuuming, do all that, but also help with transportation to appointments, if it were her knee that affected her driving. So basically, help fulfill the needs. So in this situation, we have it set up for 2 weeks and then we reassess. So we have a set schedule. That's the beauty. Even with a phone call, it can be changed, and the schedule can be changed as needed. Last example I have is just a husband and wife that live in an assisted living community. Both do fairly well. They ambulate with walkers, but he has dementia. His wife would be his primary caregiver, meaning she's the one with him all the time, even though in an assisted living community, there are much other greater needs that can be helped with caregivers being right there, but they can't sit there and be with him all night long. So if he has sundowners that sets in, and then Miss Taylor can't get any sleep, then that's just a bad scenario all around. So we can come in and do night shifts. And if he is more of a night owl, stays up late, she can sleep slowly, restfully, sleep soundly in her room. And we can just engage with Mr. Taylor. We can reminisce about his past. We can play games. We can wander around. We can prevent him from wandering around, but we can take walks around the facility inside. But if he likes to listen to music in his room or do puzzles, we can help with that. So, and then in the morning, we can help with just making breakfast and make sure morning meds are taken and get gone. So it's a win-win. Again, it addresses Mr. Taylor's immediate needs and how can we keep him safe and engaged, and give Miss Taylor the respite, the rest, everything that she needs. Again, we talked a little bit about companionship, but as people get older, 25% feel isolated and 30% say they don't have the regular companionship that they once had. And that's understandable. So if they're, engaged with you, we can have a caregiver come in. It doesn't mean they have to just stay home. So our caregivers can take them. If someone is an avid shopper, likes to go to sports games, there's, college, high school, everything around that, if they like to do that. So it doesn't mean that it's just sitting at home and dwelling at home. It can be out and about. If someone loves to go for rides in the country or wants to get out of town and go visit the ranch that once owned, or head up to Red Lodge. I mean, it's truly about, or if it's just every day, taking them to meet coffee with friends, and then hitting their favorite lunch spot. So it can be a combination of whatever that client likes to do, but it's a great solution to combat isolation and depression in our elderly folks. And I think one thing that we constantly hear at Synergy is respite care is underutilized, and a lot of people don't think they even need help until it's too far gone. So what we do know is primarily if families providing the home care, it usually lands on one of 3 siblings, or it's all on mom to take care of dad, or now maybe dad's the primary caregiver and he's never done all this stuff in the past. He hasn't had to do the shopping. He hasn't had to do the laundry. He hasn't had to try and keep the house clean because mom has. Well, now she has dementia and all those things are very difficult. So family caregivers spend an average of almost 25 hours a week providing care. And most of them work full or part-time. So after working all day, now you have to go run errands, or you have to go over to mom and dad's house and do laundry or make them dinner, or, it becomes very overwhelming. You can begin to see how having a caregiver provide that care during the day or during the night can be a huge relief. And caregivers that are family members that provide care often feel very depressed and they don't enjoy spending time. It becomes more of a burden, and they don't enjoy spending time with mom and dad because it's not fun anymore. And that's where we can turn the tide on that. We can do the chores, we can turn the workload so that when they come over, they no longer have to do all that home care stuff. So we can take that on so they can just come over and enjoy mom and dad and maybe just sit and have a nice dinner, or visit or play cards or whatever it is that they like to do. So again, how can we best help support all of you? With getting home care involved from the get-go, before patients even discharge from the hospital, we can help reduce readmission rates. We can help them immediately, with even picking them up, taking them to their home, swinging by the pharmacy, maybe hitting the grocery store on the way home, but get them settled in their home safely. And again, if they're a fall risk, we don't want them to go home and try and figure out, between the husband and wife, we think we can do it. Well, then 2 days later, she has a fall, and now, they were in for him to have a knee replacement. Now she fell. Now they're both in a world of hurt. So we'd love to get involved sooner and help them just literally work their way out of needing home care. So if they're getting nutritious meals, if they're getting the meals they need and everything that they need, then we can help them just thrive and eventually not need us. But the ultimate goal would be to keep them safe, keep them from re-injuring themselves and getting right back into the hospital. There's many ways that home care can be paid for. Primarily, it's private pay. If there's a long-term care policy that covers home care, then that'll cover it too. There is a dementia respite voucher out there that is a grant through Lifespan Respite, and that would give about $800 of care, which is amazing. For our veterans, there is a VA benefit that's allotted to many of them based on what their needs are. Medicaid waiver might cover some care as well. And what you'll hear from Tyler with Big Sky Senior Services, a lot of times they can work on a sliding scale. So they don't provide the amount of hours that we can, so we can work a lot with them where if clients need a shorter amount of care or window. But there are options, and I would say the biggest thing is never assume that the family can't afford it. I think that's probably the biggest thing I always hear from hospitals as well. They can't afford it. Well, you know what? If home is where they want to be, then a lot of times family will figure out how to pay for it. And it buys them time before they have to make a huge decision into transitioning out of their home and maybe somewhere else. So I would say, always at least let families know what's available. We do free assessments. We help meet with them and help communicate all their options. So I would say just don't always assume that it's too much money, because for them, if home is where they want to be, they'll figure out a way. It's very easy to get implemented. We can provide 24/7, but with a simple phone call. But just do some Google searches, encourage families to check that out. But also just ask the nurses, ask your care manager, ask your social worker, or if you live in a senior living community, ask who works there, or even ask around from your friends. They may have had these same needs themselves. So at Synergy Home Care, we want to be at the center of your care. So even if we aren't the people that can provide or provide the care for the needs that you have, I guarantee if you called and said, we're looking into hospice for my mom, I don't even know where to go, we can direct you. We transfer lots of calls every day directly to people that we can help, that can provide the care that your family needs. So whether it be just getting involved with senior communities, Meals on Wheels, or where to turn to for memory care, um, or the VA, So whether we can provide the care or not, we want to help just with the continuum of care for your senior loved one. So I will wrap up with that. Thanks, you guys. Appreciate your time so much.
And with that, for those of you that weren't on early, our second presenter is actually taking care of parenting responsibilities and preparing video. And I'm going to ask Alana Jarman to share her screen and play that video, and then we'll open it up for questions. Thank you. Great presentation.
Thank you.
Hi, my name is Tyler Amundsen. I'm the Executive Director at Big Sky Senior Services, and I apologize I can't be with you all this morning. But I wanted to take a little bit of time and just share a little bit about what we do in the community, how we're connected to the continuum of care, but also just give you an overview of our organization and how we engage in our work. So as I begin this morning, I wanted to start by saying we're one of two major nonprofits in Billings that looks at caring for those that are aging. So we call them in our title seniors. You'll hear the word elders from time to time. I think it's just those folks that have generally taken care of us in our community, and so we continue to care for them. Big Sky Senior Services was established in 1977. It's been a couple different programs that have come together. We're a 501c3 nonprofit. We are the second largest receiver of county funding from the levy that's focused on elderly and adults. The big funder in that would be the Adult Resource Alliance, who we partner with on a lot of projects and work in the community. The things that we really focus on at Big Sky Senior Services are quality home care at reduced rates. So we have a sliding fee scale I'll talk about a little bit more in a second. But we really work hard to make sure everyone can afford the care they need to stay in their homes. We protect elders and sustain financial independence. I'll talk about how we do that. But know that we do have trainings that can help organizations in the community look at that. Dementia Friendly Billings, which I'll show a video to you all in just a little bit, is one of our big efforts we do to get out there and do that work. And we also do trainings on prevention of elder abuse for organizations, especially banks, but also any organization that helps elders in their business practice. And then lastly, we companion volunteers. So we really do work to get volunteers alongside elders to overcome social isolation of any kind. Just to give you a little sense of how many folks we serve, we served last year about 442 seniors in our community in some way, shape, or form. That was up 8% from last year. Based on demographics, and many of you know this, there's really no end in sight to the number of people we can serve. And so we're really working to figure out how we can serve that increased capacity and continue to use our resources to meet those needs. We gave 16,000 hours of direct service last year, whether that be in-home or through payee services, supporting folks financially, or volunteer services. About 58% of our clients are at or below the rate of $2,177 per month. That's about 150% of federal poverty guidelines. If you go down and look at our notes as well, those folks that are under $1,000 a month is a good chunk of the folks we serve as well. So one of the big goals of Big Sky Senior Services, we believe that supporting in-home independence is cost effective. It promotes quality of life and helps keep seniors in their home in a place that they're comfortable, and that we know that when folks are in their homes generally, they live longer, happier, and engaged lives. Next, I want to just go over our list of services and talk a little bit about how we do what we do. We do two different programs that get into people's lives and help them primarily. And these are the list of services those complete. So we do household chores. So we go in and we help people do dishes, laundry, clean up their house in general, wipe up their bathrooms, make sure things are general living conditions are doable for folks who really might have trouble doing some of those tasks. Our nursing services are mostly just focused on medication management and risk management. So we're not in the work of doing in-home nursing. Our services are only 8 to 5 Monday through Friday to attempt to be the ones that just support at that level as well. We do pet care services. So if folks have pets, we do have somebody on staff who can actually help take care of their pets. We have worked with the respite program that was available last year, and we continue to look at how we can do respite. We know some of that money has gone away, but we're still looking at how we can support caretakers in the community. We do have a transportation, and our transportation is just for those folks that are in our programs. It is not for folks that are not in our programs. And so we are aware transportation is a huge issue in our community. So we try to meet the needs of our clients and would love to look at doing stuff for other folks. Personal care, so showers, bathing, general body care is something we do as well. We work on companionship, especially for our volunteer program. So we have volunteers that we companion with our clients that go into their homes and engage folks in relationship. And sometimes we found that our volunteers are the ones who find the gaps for folks. Even when we're in there every day, the volunteers are the ones who say, this person really needs to see a change in care. And so they've been really helpful. We do money management for folks that come to us through our representative payee services. So if you're on a form of Social Security or Railroad Retirement or VA, we can receive you as a rep payee, and we can actually, through that, help manage your money and make sure that bills are paid. You have to get a signed letter from a doctor that says you need a payee in order for that to happen. But we're able to do that. And through that, we do a lot of case management for those clients to make sure they have the resources they need, low income energy assistance, so LEAP, or some of the other programs that are needed for folks to stay in their homes. And then again, we do trainings for organizations on being dementia friendly and preventing elder abuse. And I'll talk a little bit more about that as we get through this presentation. Just so you understand how we do all those services, there's three main programs that function out of our organization. The first is Senior Helping Hands. So that's the group of folks we're sending into people's homes to do those kind of care tasks that I talked about, anywhere from basic personal care, bed management, to cleaning the house and making sure it's in good shape. That's where we're really proud about our sliding fee scale. So based on people's income when they come into the program, they receive a certain rate at which we will charge them. Our county and federal funds help offset that so that we can continue to do that service for more and more folks. That sliding fee scale has allowed us to serve a lot of people. And so that's our Senior Helping Hands program. Prevention of elder abuse is primarily the folks that we're doing payee services for. And then we also are doing some case management through that as well. We've helped with Med Part D for the clients we have in that program as a good example. And then the Friends Volunteer Program is really that effort to overcome some of the isolation by taking community volunteers and placing them in a relationship with the senior. And we're always looking for folks who are willing to do that. And we really do work hard to pair people up that make sense together and that work together well. Beyond those two programs, we have two primary community collaborations. One is the Yellowstone Guardianship Council. That is an incredible program that we took over probably about 6 or 7 or almost 8 years ago now. So if somebody has no one to be their guardian, and generally the rules are if they're over the age of 60, unless there's a specific case, and as well as the fact that they need to be in a facility is one of our other requirements. And then there's no one else who's willing to be involved as a guardian in their life. will take on those folks. So that group can range, we can be usually caring for about 8 to 12 folks in that. A group of volunteers sit on that council and care for those folks, and help take care of those folks by checking on them and acting as their guardian. The council is actually the guardians for those people. And our last big program or an effort right now is Dementia Friendly Billings. It's an effort of community-wide support, anywhere from folks from the Adult Resource Alliance to um, the Riverstone Health, Billings Clinic, St. Vincent's. We've got folks all engaged in that process. Dementia Friendly Billings is raising awareness and training folks to understand how to be dementia friendly to those folks in our community, especially when dementia is on the rise. As our community ages. I'm going to show you a video after we get done with my part of the presentation here for you to learn a little bit more about dementia-friendly Billings, because I would love to see some folks get some trainings going. We have some great news in that program that we'll be having the opportunity to train all the frontline staff for the city of Billings here very soon. And so we'd be really excited to hear about other folks, or if you're interested in helping us do some training, we'd love to train a few more trainers for dementia-friendly Billings. And then lastly, I just want to share this because I think it's helpful. Again, there's a little bit of graphical representation of those services I've already talked about, but our funding sources and how we engage the community and use resources that are both grant-based and levy-based, as well as private funds to help make this all happen. So we bring in some revenue from the folks on that sliding fee scale, so that's about 20% of our income that we use to support the work we do, and that goes back to help other folks. We get about 7.9% of our money from the federal money and 12.9% from the state. Those come from the Area Agency on Aging. United Way is about 3.6% that we get. Yellowstone County is a big chunk of our funding, so we get part of that mill levy funding. And that helps us do a lot of our case management and especially our prevention of elder abuse work. And that's about 33% of our funding. And then St. John's United Home Health, we actually have a collaborative with them. We do get some money from that as well. And we do about 10% of our fundraising. So we have two big fundraising efforts to get a lot of those funds. The Rubber Duck Regatta, many of you saw happen at the zoo, and then Dancing with the Big Sky Stars, which will be happening virtually again this next year. So we're really excited about that. So that's Big Sky. Again, we really focus on those vulnerable adults, those folks that need services in our community, and we're working pretty consistently to advocate for those folks. I'm hoping to be on the phone with you today to answer questions, so if we get a chance to do that, I'll be available. Before I go, I'd love to show you a short video about dementia-friendly Billings, so you might consider that work being done too. If you have questions about our care services or in-home care for senior helping hands, don't hesitate to reach out. My email is tyler@bigskySeniorServices.org. You can also call our office at 406-259-3111. Thank you all for all the work you do and the care of people in our community. And I just want to thank you for your time today. And here's that video.
I think we'll forego the video because I want to make sure we have time available. This entire session is being recorded, so if you're interested in that video, I don't want to act like it's not important, but I want to make sure we have time for questions and answers. So with that, I'm going to turn to a question to you, Crystal, from Linda at Riverstone about your being a corporate entity and the level of training that's required for some of the functions that you perform, especially with dementia. Can you talk a little bit about how that onboarding training works so that everybody understands the process that at least your company uses?
Yeah, absolutely. So we have varying levels of experience with our caregivers. So we have retired nurses, so RNs, we have CNAs, we have brand new caregivers, so they might be in college and are substituting are working a little bit and all that, just to get hands-on experience to see if this is a field they want to go into. Or for some, it's a second job. They might just work on nights and weekends. So we have a lot of varying experience, but we've had numerous caregivers that have gone through actually Linda Rohr's dementia training, her TPAS Snow, which has been fabulous, which I've done just to learn for myself. I'm not a caregiver myself, but it's amazing. And so Linda, we cannot thank you enough for training our people. But on top of that, we obviously cover the basis of everything, but then for our clients that need more one-on-one dementia specific care, we only have those experienced caregivers go with them. So with us being non-medical, if it's above our needs, or if they have more skilled care needs, we can help get involved home health or skilled nursing care. So there was a question on there too about dementia patient that had a fall and broke her hip and is still not walking. We with the continuum of care, like I said, our whole goal is to reach out and get all those involved that we can, that can help make that patient's life the best that it can be. So yesterday I happened to be at a client with a physical therapist. It was my second visit to that house. When I was at that client's house, she said there was no way she was going to get up. Well, the physical therapist had her up and walking with her walker, trying out different recliners, and it was absolutely amazing. And she felt so good about herself because she figured she'd only be able to sit in a chair all day long because she didn't have the help that she needed. And she didn't think she could do it. She didn't think she was strong enough, but it was so amazing, and she was so proud of herself. So I can see her continuing, but just to get better and better. But yeah, we want to reach out, and if home health is the answer, we have partnerships with trusted professionals that can do a fabulous job and get involved. So it's all about the continuum of care and coordinating and doing what we can to help each other, help the patient the most.
Thank you. Deb Anderson has a question about the average private pay cost for dementia trained staff. Can you give us some idea, at least as far as synergy goes, how that works?
Yeah, and kind of across the board, I think it can vary from maybe 28 to 35 an hour. It's just dependent upon agency specific. But for us specifically, we're right about 32 an hour, and we have a 4-hour minimum. But I think there's some agencies that will provide maybe 1 hour care for $50 or $55 or something like that an hour as well. So it really just depends on who you reach out to and whatnot. But I would think that would be pretty normal.
Both you and Tyler made it a point to stress that you don't provide medical care. Give us some idea how you interact with those professionals and entities that provide treatment. Once these patients go home, who do you rely on to understand their condition so you have some context to provide the care that's needed?
Yeah, that's a great question, and it's so critical. That's why I stress, ideally, we would love to meet them in the hospital before they ever even head home, because then I can meet with case managers, I can meet with their nurses, I can meet with whoever needs to is privy to the information of what their cares are. Because if you ask the patient, they don't need any help, they're good, they're headed home, they're fine. And you ask the case manager who's in charge of them, and you're going to get a completely different story. Our whole goal is to not come in and take over, but help them realize all the ways that we can help. It's going to be tougher than they think when they head home and these things haven't been taken care of, or just physically not being able to do what they want to be doing. So our goal is to have more care initially and then be able to wean it back when they are stronger, when they are, you know, capable of doing more on their own. So we would, you know, our care plan would be all the things that would be suggested by whether it be the physical therapist or even just case manager of, you know, they need help in the morning and the evening, they've got someone that can help during the day, or they need, you know, 12 hours of care. Or if it's the night, that's the biggest fall risk. So we work specifically with hospital or rehab or even the physical therapist, and we can help with doing the therapy exercises while the caregiver is there. So it's not just 3 days a week that the actual physical therapist might be there, or occupational therapist. We can do it every day with them numerous times a day. And if it's just out getting exercise and having someone standby assist, you know, we can implement those plans.
I want to stress to everybody that we have 2 providers of home care here, and there are different business models. So every one of these is going to be different. And I'm going to attempt to work up a master sheet of all the providers, at least in this area. But in the case of Synergy, Crystal, how far out from Billings do you work? How far out do your resources allow you to stretch?
So we will go literally anywhere. So we just assess the mileage. So we have clients in Columbus, Absarkey, Red Lodge, Rygate, Roundup. So we would just assess a per mileage charge for the shift charge. So whether it's a 12-hour shift or a 4-hour shift, it would just be the mileage charge. For our other facilities and hospitals, we also provide one-way transportation, and that's all just basically calculated mileage and time. So we literally will go anywhere. It's just that if the client agrees to what it would cost to get there. So we're not limited, you know, into a certain region at all. So if, you know, literally we'll go anywhere that people need care if they agree to the mileage charge.
Everybody's being sort of quiet out there. I'm wondering if there's any other questions of Crystal or any thoughts that you'd like to share about care transitions when people are handed off from your entity to others, including those that go home. Any thoughts that you'd like to share? If there aren't any other questions, I'm going to ask that we play the video that we weren't able to play because I want to make sure we had time. But are there any other questions anybody has of Crystal? Alon, if you can you play that video that we had to interrupt?
Yep.
Okay.
I just wanted to pause, see if anybody had any other questions or comments. I guess probably one of the biggest, like maybe more comments that I have is just throughout Montana. I guess, you know, when we look at these types of services for older adults, how people know that they're available and what is available to them. So, I mean, I guess you don't have to answer it now, because I think that there's probably a bigger question out there. How do people know and how do providers know? Especially I'm thinking of folks that are on from IHS that, you know, within IHS, they get locum doctors. And I would dare say even, you know, Billings clinics, ABs and stuff, that you get people from out of state that care for older adults and may not know. So I'm just wondering, I assume that's like care navigators and case managers and things that can help set them up. But
yeah, that's exactly it. And I think a lot of people don't know until they're in this world, and now it's like, oh my gosh, where do we even start? So like I said, if anybody that calls our office, whether they need home care or not, but they just know that, oh, I've seen this company, they call us, we will literally transfer them right to where they could go. I mean, and provide them with all the information they need. My girls at the office will get on and Google and here's some numbers, try this, or if we know specifically. So it is so critical that at the core of all of it, we just all need to and want to take care of the patient need and just help them live the best quality of life, right? And just get them in touch with who can actually help them and provide those services. So I think that's what I love about this community, working in the senior living world is that's ultimately everybody's goal. Like, let's just help these people live the very best lives they can.
Any
Agree
other
on that.
question? Let's play the video, Alana.
Okay.
And here's that video about dementia-friendly.
A dementia-friendly community raises awareness of and develops respect and inclusion for people with dementia and has services and resources embedded in all areas of the community to ensure meaningful access to the community and promote quality of life. Dementia is a general term for a loss of memory and other thinking abilities that is serious enough to interfere with activities of daily life. And we like to emphasize interfere with activities of daily life.
In Montana, Alzheimer's and dementia are a problem of growing concern. Montana is one of the grayest states in the nation. And while that's a wonderful distinction, it also increases the risk for our residents experiencing Alzheimer's and all dementias. Age is one of the greatest risk factors. Again, while not normal aging, Alzheimer's certainly does predominantly impact those that are 65 and older. In fact, 1 in 9 seniors that are 65 will have Alzheimer's. 1 in 3, 85 plus, will be living with this disease. And of the top diseases that take people's lives, Alzheimer's is one where we have no way currently to slow, stop, or prevent it. Research is underway now looking for ways to improve treatments, to improve early detection and interventions. But it is certainly something that we all benefit from understanding and knowing more about.
Dementia is an umbrella term used to describe a range of symptoms associated with cognitive impairment, such as thinking and reasoning. The different types of dementia include Alzheimer's, vascular, Lewy body, and frontotemporal disease.
You may be wondering why being dementia-friendly is important. For employers and employees, for your customers, for yourself. Employers should care about creating a dementia-friendly workplace environment because 57% of employed caregivers had to go into work late, leave early, or take time off due to caregiver demands. Attract new customers. Staying engaged in community life means using the businesses that are easy to navigate and have helpful, aware staff. For yourself, you should become aware of community resources and online education programs to learn more about the different types of dementia and the stages and warning signs of Alzheimer's. Someone in your family or your friends or neighbors will likely be affected by this progressive disease.
It's important to understand the 10 warning signs of Alzheimer's. Things like memory loss, changes in planning or solving problems, difficulty completing familiar tasks, decreased or poor judgment, and others. We'll be looking at the difference between those changes that are a result of normal aging and those that are more worrisome and might indicate Alzheimer's or a related dementia. We've all lost our keys from time to time, but we're able to retrace our steps and find them. Finding our keys in the freezer? That actually might be worrisome and the cause for more concern.
We will customize the presentation by playing short videos of different sectors of the community. These will be examples of how to interact with individuals with dementia and their caregivers.
We will discuss a number of ways to communicate to those with cognitive impairment or dementia. Speak slowly and clearly and be patient. Listen and watch closely. Smile warmly and make eye contact. These are a few examples.
After your staff training, you will receive a certificate suitable for framing, a dementia-friendly Billings decal for a door or window, and photos to use on the Dementia Friendly Billings Facebook page and website.
If you would like to discuss a virtual or live 30-minute training session or sessions with your staff, or if you know of another organization who would like this presentation, please contact Dementia Friendly Billings at Big Sky Senior Services. The contact info is on the screen. You can go to our website at dementiafriendlybillings.com or contact me, Suzanne McKiernan, at info@dementiafriendlybillings.com or phone 406-259-3111. Thank you for your time and interest.
Wow, that was very well done. Anybody have any questions because of as a result of watching the video of Crystal, or there's other providers on the phone, and if you have any thoughts you'd like to share, please weigh in. If not, Crystal, and I'm not sure if Tyler's actually on the phone or not, but Crystal, any closing thoughts from you about any wrap-up thoughts you'd like to share with us?
I just wanted to thank you guys for the opportunity and very much appreciate, the kind comments and support. But, bottom line is, we just want to help. And I think home care can be a huge, huge bonus to helping people stop going to the hospitals or keeping them out of hospitals or rehab facilities as much as possible, and help them just grow and get stronger and thrive at home. And again, that could be in a facility or whatnot, but bottom line, help them just live their most best quality of life possible, keep safe. And but I really do appreciate the opportunity. I added my information on the chat box if anybody had any specific questions or anything like that. So thanks again so much. I appreciate it.
I'm going to share your contact information and Tyler's. And for anybody out there that knows of home care providers in the area here in Billings, I have a list, but I want to make sure I've got as many as possible. I will be happy to include those as well. So with that, thank you all. Happy holidays. We're not going to meet later this month. We're going to meet in January, and we're going to have a presentation from the Veterans Administration here in Billings. So with that, happy holidays to everyone, and thank you for joining us today.
Thank you.